Hello Pharma friends, welcome to Pharma Syndrome YouTube channel. Today we will discuss on the classification of drugs used in Parkinsonism. I hope you already subscribed to our channel. If not, please subscribe to our channel for daily updates regarding pharma information, regarding education as well as job updates. Okay, let's go into the session. Parkinsonism. Already you know Parkinsonism is a neurodegenerative disease. The disease is because of degeneration of neurons in the brain, especially central nervous system. And in Parkinsonism, what is happening? There is an imbalance between the dopamine and acetylcholine. So dopamine, the main role, regulates our body movements, and acetylcholine mainly regulates our skeletal muscle contractions. And apart from that, both neurotransmitter having other functions, but here mainly the Parkinsonism is because of imbalance between dopamine and acetylcholine in the nigrostriatal area of the brain. And especially in this condition, decreased dopamine levels and increased acetylcholine concentration. సో అంటే ఇక్కడ డోపమైన్ లెవెల్స్ తగ్గిపోతున్నాయి, acetylcholine లెవెల్స్ పెరుగుతున్నాయి. సో ఎప్పుడైతే డోపమైన్ లెవెల్స్ తగ్గిపోవడం వల్ల ఏమవుతుంది, డోపమైన్ లెవెల్స్ అనేవి తగ్గిపోవడం వల్ల బాడీ మూమెంట్స్ తగ్గిపోతున్నాయి. అంటే మనం కదలికలు, మన చేతుల మూమెంట్స్ కావచ్చు, కాళ్ళ మూమెంట్స్ కావచ్చు, హెడ్ మూమెంట్స్ కావచ్చు. బట్ acetylcholine లెవెల్స్ పెరగడం వల్ల ఏమవుతుంది, షివరింగ్ ఎక్కువ అవుతుంది. If you observe old age people around 60 to 70, so their movements are slow, but their hands and legs will be shake. That is because of little bit symptoms of Parkinson's. So due to domination of acetylcholine, there is a shivering observed in the old age people. Here, our main motto of treatment in the Parkinsonism to increase the dopamine levels and to decrease the acetylcholine levels. And most of the drugs in this classification, 90%, they increase the action of dopamine in different ways. And in that the category, the first one is dopamine precursor. So levodopa is prodrug which increase the dopamine action, and it is a dopamine precursor. Once levodopa enter into the body, it increase the dopamine action. Next, dopamine receptor agonist. So in the above condition, levodopa అనేది బాడీలోకి వెళ్ళాలి, ప్రోడ్రగ్ గా కన్వర్ట్ అవ్వాలి, అది డోపమైన్ గా యాక్షన్ చూపించాలి. అండ్ హియర్ dopamine receptor agonist drugs like bromocriptine, ropinirole, pramipixole, these drugs directly interact with the dopamine receptors in the brain and regulates the Parkinsonism symptoms. And especially the person with Parkinsonism disease, there is a decreased body movements and also a abnormality in the memory and learning also. And next, MAO-B inhibitors. Monoamino oxidase B is one of the enzyme which may involves in the metabolism of dopamine. అంటే ఇక్కడ MAO-B అనే ఎంజైమ్ అనేది డోపమైన్ ని మెటబలైజ్ చేయటం వల్ల ఏమవుతుంది, డోపమైన్ లెవెల్స్ తగ్గిపోతాయి. సో డోపమైన్ లెవెల్స్ తగ్గిపోతే there is a chance to get Parkinsonism. That's why here directly targeting MAO-B, monoamino oxidase B enzyme, by using drugs like salicylic as well as rasazylic. Both salicylic and rasazylic are irreversible MAO-B inhibitors. Both are irreversible MAO-B inhibitors. And next, going forward, next category of anti-Parkinsonism drugs, COMT inhibitor. So COMT especially inhibits the degradation of dopamine in the CNS, peripheral as well as CNS. So to prevent dopamine degradation and to increase the dopamine concentration, we have to target COMT also by using drugs like tolcapone as well as entacapone. Tolcapone as well as entacapone. Entacapone is a peripheral COMT inhibitor, and tolcapone is a both peripheral as well as central COMT inhibitor. And next, NMDA receptor antagonist. So the drug is amantadine. Amantadine is a drug can block the NMDA receptor and also inhibit the dopamine reuptake. అంటే జనరల్ గా డోపమైన్ అనే న్యూరో ట్రాన్స్మిటర్ యాక్షన్ చూపిస్తుంది. యాక్షన్ చూపించిన తర్వాత మళ్ళీ ఏమవ్వాలి, వెనక్కి వెళ్ళిపోయి రీస్టోర్ అవ్వాలి. ఇట్ హ్యావ్ టు రీస్టోర్ వన్స్ ఇట్స్ యాక్షన్ కంప్లీటెడ్. బట్ ఇన్ కేస్ ఆఫ్ పార్కిన్సోనిజం ట్రీట్మెంట్, we require more dopamine at the target. That's why we have to inhibit the dopamine reuptake. If dopamine is not reuptake back into the synaptic vesicle, the dopamine more time present at the synaptic vesicles, receptors, and shows the anti-Parkinsonism action. And the drug is amantadine. I hope you know amantadine is also a antiviral drug, especially inhibit the uncoating of the virus particle. Okay, so what is the need to block NMDA receptor? I hope you know NMDA receptors comes under ionotropic or ion channel receptor, and NMDA is a excitatory in function. So due to excess activation of NMDA, there is a excess excitation in the brain neurons, especially nigrostriatal pathway neurons, which may lead to damage of the neurons. So excess activity of NMDA may damages the dopamine neurons and may develops the Parkinsonism. That's why need to block the NMDA receptor. And example is amantadine. Amantadine can block the NMDA receptor and also inhibit the reuptake of dopamine into the presynaptic neuron. And if the reuptake is not happening, more time the dopamine present at the target and it decrease the Parkinsonism symptoms. And next target is dopa decarboxylase. So dopa decarboxylase is one of the enzyme majorly responsible for the decreasing bioavailability of levodopa. అంటే జనరల్గా లీవోడోపా లాంటి డ్రగ్ ని ఈ కార్బిడోపా కానీ బెన్సరాజోయిడ్తో కానీ కలిపి తీసుకుంటారండి. ఎందుకంటే లీవోడోపా అనేది పెరిఫెరల్ నుంచి సిఎన్ఎస్ కి వెళ్లే లోపే పెరిఫెరల్ గా డీగ్రేడ్ అయ్యే ఛాన్స్ ఉంది. దానివల్ల లీవోడోపా బయో అవైలబిలిటీ పూర్తిగా తగ్గిపోతుంది. ఓన్లీ ఫ్యూ అమౌంట్ ఆఫ్ డ్రగ్ రీచెస్ బ్లడ్ బ్రెయిన్ బ్యారియర్ అండ్ దట్ మచ్ ఈస్ నాట్ సఫిషియంట్ ఫర్ ద ట్రీట్మెంట్. దట్స్ వై always levodopa should combine with dopa decarboxylase inhibitors like carbidopa as well as benserazide. Carbidopa as well as benserazide. And the treatment of Parkinsonism, our main motto to increase the dopamine and some percent we have to decrease the acetylcholine action also. So dopamine action తగ్గటం వల్ల acetylcholine action బాగా పెరగటం వల్ల Parkinsonism వస్తుంది. That's why in the treatment of Parkinsonism, we have to decrease the acetylcholine action and we have to increase the dopamine action. And in this category, we have to block acetylcholine function also because the acetylcholine function is higher in case of Parkinsonism. And anticholinergics like benztropine, benzhexol, piperidine, procyclidine, all this can block the excess acetylcholine action in the Parkinsonism. And in the treatment of Parkinsonism, some of the drugs like diphenhydramine, promethazine, or phenadrine can be useful because they also having anticholinergic properties. But generally, these drugs are H1 receptor blocker antihistamines, but non-selectively, these drugs like diphenhydramine, promethazine, or phenadrine can also block the acetylcholine action, nothing but muscarinic receptors in the CNS, and controls the Parkinsonism symptoms. So like this, you can easily remember and understand the classification of anti-Parkinsonism drugs. The Parkinsonism is because of imbalance between acetylcholine and dopamine in the nigrostriatal area of the brain. And in the treatment, we have to increase the dopamine action and we have to reduce the acetylcholine action by using this category of drugs. Okay, so and once again subscribe to our channel and follow our channel. If you are preparing for a drug inspector, pharmacist as well as GPAT and NIPER, so please contact us and my number is 7995318103. If you want to qualify for the competitive exams, you should always touch with the subject. So మీరు ఎప్పుడు సబ్జెక్ట్ తో టచ్ లోనే ఉండాలి. Otherwise it is not easy to get into the competitive sector because there is a very high competition in the sector, and hopefully there is a lot of hope to release a notification for the drug inspector, including central as well as statewide, including pharmacist central as well as statewide. So the notifications are coming, and they will come throughout the year also. So please be focused. If you require any suggestions, motivation, if you require coaching, kindly contact me on the 799531810, and we will connect in the next video. Thank you.